This video today is sponsored by me because I make my own products and I sell them on my website, designed with you and your client in mind. They are organic, good for the skin, and good for your work. And for a limited time only, get your hands on some myofascial world peace, because peppermint and cardamom and, world peace. Today I'm diving back into the deep muscles of the spine, which I have just done on my most recent video, in which I had my client prone, but this time I've flipped my client on her side, and later I will have her supine, and I want to take a minute to expand on the importance of working on your client in different positions. The way a muscle receives work is a lot like the way a person receives any information from the outside world. So you can grow up loving a certain food, but once you've learned something about that food, how it's made or why it's not good for you, your perspective about that food changes. The same is true for a muscle. Shift the way that the muscle receives that information, and that muscle is going to respond in a whole new light. So I've got my client on her side. I'm working deep into the transversospinalis group, but because of her position and the different angles with which I'm working, these muscles are receiving this work from a very different perspective. A couple of things to note right off the bat: because your client is in side lying and not prone or supine, there's going to be a little bit of a lateral curve, which actually you can use to your advantage. So I'm working on the muscles on the right side of my client's spine, and in the lower back, these muscles are going to be a little shortened, which means they're going to be softened, and throughout the thoracic and upper spine, they're going to be lengthened and opened up. The other thing is that I'm using my left hand to shift the way her pelvis is sitting. So as I push her leg down towards her feet, this pulls her pelvis down away from her torso, which allows some space between the vertebrae and allows me to shorten and lengthen these muscles so that I have a lot more manipulation of what these muscles are doing as I'm working. Consider this a tiny pin and stretch. So as I pin down the multifidi and the rotators, I am then stretching them out by creating space in between each of the vertebrae and moving my way up the back in this manner. As I move higher up into the thoracic vertebrae, I'm sliding out laterally a little bit and addressing more of the erector spinae group, but you can stay into the transversospinalis group or slide up through the trapezius all the way into the shoulder or up through the neck, whatever you decide is best for your client. I've switched my position to the head of the table, and I'm talking to my client about lifting her arm up and rotating her shoulder backwards, because part of the job of the transversospinalis group is to stabilize the spine while the limbs are moving. So as she lifts her arm up and creates a movement through the shoulder into the rib cage, the spine is holding stable, and my focus here is to create a compression into these stabilizing muscles so that when she relaxes back down, I sink in a little bit deeper and repeat this process down the spine. I'm going to show you this again, but I want to dive into the fact that there are not only multiple techniques happening here, but there are also multiple effects. So as I create this compression into these stabilizing muscles, I'm also sliding down the lamina groove and creating a myofascial release betwixt and between all of these little tiny muscles that are moving into rotation and holding into stabilization. The other profound effect that happens is that your client will start to realize how much spinal muscles are engaged to create arm movement. So the sheer awareness, whether it be neurological or philosophical or however you like to look at it, that core strength and core muscle health dictates the way the rest of the body moves is going to be essential to how your client can move through their own pain. And guess what? We can do this with the legs too. A couple of things right off the bat. I'm standing on her anterior side so that you guys can see what's happening. And the other thing, she is wearing pants. I highly recommend that if you know you're going to do this technique, have your client wear comfortable pants or shorts so that you don't have to worry about draping. As you guys can probably guess, with movement of the hip, you're going to get a lot more stabilization in the lower spine and most specifically the QL. So as my client lifts her knee up, I started with focusing in on the QL, and as I move my way up the transversospinalis group. When she relaxes her knee down, I'm using my left hand to push her knee down closer to the table and down towards the floor, so that after she contracts these muscles to lift her knee up, when she lets go, she's really opening up these lumbar muscles, and that extra push towards the floor allows for a little more stretch and allows the work that I'm doing to sink in a little bit deeper. For an added layer of manipulation, if you have your client resist your pressure down into the lateral knee, you're creating an eccentric contraction, and then the work that you're doing in the spine is going to have a lot more depth and complexity. When you're working with an eccentric contraction, you're compressing into a contraction, and as these muscles get longer, your compression is enhancing the way that these muscles communicate to the brain. And I'm taking her pillow out because I'm about to get her to move. There are so many things happening here, but don't worry, I'm going to break it all down for you. So as I sink into the transversospinalis group, I'm going to slide down inferiorly towards her sacrum, and I'm going to have her pull her body into the fetal position. So what this does is a combination of a reciprocal inhibition and a pin and stretch. And let me talk about what that means. So the pin and stretch is as I pin these muscles down, she is stretching them out by curling into this position. And as I slide down the lamina groove, I'm getting extra depth into these muscles that are stretched out. But the added bonus of the reciprocal inhibition means that she's contracting her antagonist muscles. So just as a review, the abdominals are the antagonist muscles to the back. As she contracts them down, the back muscles, the opposite muscles, have to then relax. And I'm using this to my advantage. One more time because this move is just that awesome. As she pulls herself into the fetal position, I am sliding down the lamina groove, creating an unbelievable length and stretch down these tiny little muscles. And while she's in this position, why not do a little extra work? These are the muscles that create stabilization and posture, and they need a lot of love. Working on the back with the client supine can be equally as unique. So I've got my client with her knees up, feet on the table, and I'm asking her to rock to the side so that I can find those spinous processes, slide just lateral, hook my fingers up into these tiny little deep muscles, and as she falls back down onto my hands, the weight of her body becomes the pressure. Now that I'm in this position, I've asked my client to rock her pelvis into a posterior pelvic tilt. So what that does is engage the abdominal muscles and allows those back muscles to expand and lengthen. And from this position, the added bonus is that this action pushes the back down into the table against my fingers. So I'm creating a pressure and a length into the transversospinalis group with her doing most of the work. I'm going to practice some pin and stretching by pinning the muscles down and having my client move her own leg around. But do you ever have those moments where you ask your client to do something and they do the polar opposite of what you want them to do? It happens to me a lot, so I spent a little time explaining to her exactly what I wanted her to do, bringing her knee up towards her chest and then bringing her knee across her body, both of which are going to lengthen these muscles after I pin them down. The second one, bringing her knee across her body, is going to create a twist and a rotation, so I wanted to make that clear, so now I can get started. Lifting her hip up so I can ensure once again that I'm on the right muscle group. When she pulls her leg back down, I'm pressing down into those muscles, and then I'm going to have her pull her knee towards her chest, which is going to lengthen the muscles from superior to inferior, creating a nice opening vertically. And then as she brings her knee across her body, the muscles start to twist, and the work that I'm doing sinks in and creates some compression around the different elements of these tiny little muscle fibers. As her leg lays flat back down on the table and I walk down to create some traction through the hip and the knee and the ankle, I just want to remind you that if your client is active with you and engaged and moving on the table, you are not doing all of the work. You conserve your own energy, you save your mechanics, and you have a longer career. Yay, teamwork. I could not have made this video and videos like these without the support of my muscles and my brain. I'm just kidding. Without the support of my patrons over on Patreon. If you're interested in supporting what I do, please head over to Patreon. I'll include the link in the description below. Thank you for considering it. Thank you for watching, and I'll see you next time.